Okay, so today's video is surgery versus weight loss medications. It's never quite that simple. It's not really one or the other. Many patients I see have already tried these medications, and they would include Ozempic, Wegovy, Mounjaro, and there'll be others in the future to come. And they're quite powerful medications, and they're now freely available in Australia. There are a few issues with them. They do have some side effects. They would include nausea, vomiting, constipation, mental health issues occasionally, gallstones, although that may be to do with weight loss, pancreatitis is occasionally reported. Next thing is they are quite costly. Certainly Ozempic is about $140 a month. Wegovy, similar medication but a higher dose, is about $440 a month. Mounjaro is really quite expensive, $700 a month. So there's the cost. And we also know that when patients stop them, they're quite likely to get fairly significant weight regain. And if you follow people long enough, most patients tend to put their weight back on again. There's also some concerns about muscle loss. And it's particularly a problem for patients who losing weight, lose some muscle. If they stop the medications, if they've lost a lot of muscle, that's their metabolism that they've lost, and they can sometimes get more weight gained than they had before being on the medications, which is super frustrating. Surgery, on the other hand, obviously it's a bigger deal. Having an operation, it's a permanent thing. It's a bit more of a decision for a lot of patients, and they often hold off to try the medications first, and that's fine. But surgery is very powerful. Sleeve gastrectomy, gastric bypass, very predictable weight loss, very solid resolution of comorbidities like diabetes and high blood pressure, sleep apnea. And they can be done very safely, and they're very effective. And they're tried and tested. We've been doing these surgeries for 10 to 15 years, especially sleeve gastrectomy, gastric bypass in one form or another for 50 years, really. So we're very familiar with the side effects and the results we expect to get. And what I tell patients is, if you've got a low BMI, you might as well try these medications. They may work for you if you feel more comfortable giving it a go. And then if it doesn't work, you can look at surgery. But I do think for bigger patients, BMI 40s, well, 35 really, 35 and above, 40, certainly in the high 40s, these medications are just probably not going to give you enough weight loss. You might lose 10 or 15 kilos, but if you're 40, 50 kilos overweight, it's probably just not going to be enough. And so I'm quite happy for patients with high BMIs to come and see me, have a consultation and head down the pathway of surgery. So really it comes down to, it's obviously up to yourselves as patients. You can discuss this with your GP. And if you have a low BMI, I certainly think it's worth trying. And then you know you've exhausted everything. And if it doesn't work, you can come see myself in our practice at Advanced Surgical, and we can discuss the pros and cons of surgery with you. So I hope that's helpful. Okay, bye.